Hello, everybody. Thank you for watching the Dr. Mike and Shannon show. Today, I have a question. And this is going to be for Dr. Mike.
Okay.
So UNLV has the year of LBRS. How did that come about? And can other schools bring the BRS in?
Okay, so I will tell you the story of how UNLV Medical School ended up getting their hands on a Urival Bulbocavernosus Reflex system and why that's such an interesting situation. So it was almost 12 or 13 years ago. A very good friend of mine was the director of, she was a urogynecologist, a prodigy actually. And she decided to create a pelvic floor rehabilitation program. In that, she got a grant, money. That's how schools work, right? They got a grant for about $150,000, a nice grant. In that, they had to use up a good portion of it on the medical equipment and supplies to be able to do a pelvic floor rehabilitation therapy program. So she was she worked with one of the urodynamics companies, and the urodynamics company quoted her a price of $150,000 for their urodynamics machine. I was there when it happened.
I wonder why.
And it was funny because in my career, I've literally never seen a urodynamics, especially back then, a urodynamics machine valued at $150,000. That was now it's a little bit different because they're charging an arm and a leg for these things, but back then it was shocking. So within it, she was able to get a urodynamics machine. She was able to get a Uroflow machine. She was able to get an ultrasound, bladder scanner machine. And then that company also threw in something called a Urival, a Bulbocavernosus Reflex system to be worked with urodynamics. And as we know, Bulbocavernosus Reflex is something you're supposed to really do before urodynamics. You're not supposed to do it with urodynamics or maybe after when they're coming back for their results. One of those two places to get the neurological response. So, but that was with UNR, University of Reno, Nevada. Fast forward now, so let's fast forward a year after. Her pelvic floor program had nobody that knew how to get it off the ground. Nobody that even knew how to run these machines. Nobody knew how to do it. And then along came Dr. Mike. And so I walked in and I talked with the director. And I walked in, we were talking about some other things. And I looked at this machine that was kind of in the corner of the procedure room. And I said, isn't that a full-blown urodynamics machine with bladder scan, with all the other things that I was aware of? And she said, yeah. She said, but I have such a trouble finding anybody that knows how to use it. And I said, how much did you pay for that? That's been sitting there for 2 years and not, it had a cover over it. I was able to see because it was a clear cover, so I could see what I was looking through. It's the only way I knew what it was. And she said, we spent $150,000. And I said, how much have you made off of it? How much knowledge have you gained off of it? She said, and I actually turned it on. I was amazed that it still worked. They had done 3 patients with that device.
In 2 years. Wow.
2 years. And that's
$150,000 paperweight.
$150,000 paperweight. And that's what we should label this video, $150,000 paperweight. So,
yes.
So in that, I told her, I said, hey, how about if I come to work for UNR and I do this for you? And she said, well, we really can't hire you for that, because she didn't think that there would be even enough patients who would want that, a pelvic floor program. But she said, we will let you 1099 and you create your own separate company, and we'll 1099 and then we'll pay you based on, what you do. And then sure enough, that's how my company got formed in specializing in pelvic floor rehabilitation. Well, within that, I guess it was 15 years ago, I took every piece of device that was involved in that and I learned what it was, because now I'm getting paid based on what I do. So I want to do everything that I possibly can. And in it, I discovered the Urival. And then I started researching what that was for and why we should do it. And even to this day at medical schools, they teach Bulbocavernosus Reflex the old-fashioned way. Why they don't all have a Urival, we'll talk about that in a second. But fast forward to today, UNR became UNLV. And when it became UNLV Medical School, the only outside program that survived that transition was me and the pelvic floor program. Why? Because nobody knows how to do it. And so it's just a novel kind of a concept to be able to bring pelvic floor rehabilitation and put it into the OBGYN space. And it fits, I can honestly say, very, very, very well. So that's how UNLV got the Uraval. Within that, all medical schools should have a pelvic floor program, and within it, teaching their students the Bulbocavernosus Reflex, the S2 through 4 keeps poop off the floor. And
right, that your students say.
That's right, as my students say, and how to be able to use this very awesome device to be able to get that information without there being pain, and to get a number that's actually accurate and objective. All medical schools should do it. And I can promise you, UNLV is probably the only one out there that has a Uraval. And it's a real shame. It's a real shame.
So now, which departments use the Uraval? OBGYN? Can other departments also share if they wanted to? Let's say they're a smaller school, or don't want to. It's not that pricey compared to the 150,000. Not near that pricey. It's
not even close. Yeah, not even close.
It's not even a quarter of that.
Not even close. Yeah.
If they want to bring it in, what departments can benefit from the Uraval BRS?
So of course, if they have a gyno department, that's a no-brainer. If they have some kind of a urology based program, that's a no-brainer. If they have internal med, that makes a lot of sense, specifically dealing with constipation, diarrhea. That's more fecal based than urinary based. But if they have a department or a residency that specializes in internal med, that's a perfect place for it. And I would even go so far to say, if you have a neurology based program, residency of some type, that would make sense. And then, hey, let's just face it, medical students all start kind of on that same path. They specialize in their residency and as they kind of can go out, but becoming that doctor for that first, second year, it makes a lot of sense to have an understanding of those nerves. And the Uraval is a great teaching tool for that exact purpose. So,
and the great thing is we can actually come in and have a school to actually try this before they make a decision on, to make sure that it's going to be something that they want to actually move forward with in instructing their students. Which, when we did the ACOG event up in DC or up in Baltimore this past year, that was one thing that I wish we would have seen this in school. They heard about the S2 through S4, but they really didn't know what to do with it, and how it really helped having, they said the assessment would have been a big help, having something to be able to do the assessment, to actually have concrete evidence of what's going on, and be able to refer them to pelvic floor.
Yeah, a lot of them are still using this like needle poking technique. And it's not only is it not objective because you can't measure it in time, so therefore it's not reimbursable, it's also painful to the patient. And a lot of doctors say, they do it to learn it because you got to learn it to be able to pass medical school, but they would never do it to their patients because their patients would never come back to see them again. They don't want to cause pain for something that doesn't give them an objective number, and I understand that. However, the Uraval without pain gives that objective number, and it kind of brings it all in full circle. So I really highly suggest people to take, especially medical schools, to take a look at this device. It makes sense.
Yes. So students of the future, hopefully this will be at your fingertips when you are in med school.
Yep.
So Dr. Mike, thank you very much for being able to explain, to medical schools how your medical school is actually using the Uraval BRS. Any last thoughts?
I just think as we continue down this road of medicine, the Merck manual is a great guideline, and we need to be able to see what they're telling us to do as a process, and make sure that we're not skipping ahead. Because I feel like a lot of physicians, a lot of students do that mainly because they're just trying to figure out what time they have to limit, but don't miss the important things just because you haven't researched better ways to do it. That's my advice for today.
And it's only 5 minutes, non-invasive, no electrical stimulation. It can be rolled from room to room. So it's not a $150,000 paperweight. It's
Absolutely.
something that's going to get used. And you would be surprised, probably a good 60% or more of your patients would be qualified to be able to actually have the assessment done. So I want to thank everybody again. Please don't forget to like, subscribe, and share so we can keep bringing you more educational video content, and have a great day.
A great one. Thank you.